Shifting gears now, autism is on the rise due to an increase in screenings and also better diagnosis. But are some health officials too quick to label children?
Dr. Poonam Alaigh, our medical expert, is here to discuss that disorder that affects more than 1 million children throughout the entire U.S. Doctor, thanks for joining us today.
Thank you.
How do you describe autism? I mean, kind of put it in a box for us.
Yeah, so autism is a neurobiological disorder, and it really consists of 3 main aspects of a child. The communication skills and language barriers, the social interaction, and also behavior that's pretty repetitive and restricted. So those are the 3 main hallmarks of putting that syndrome together.
Well, let's talk a little bit about something called the autism spectrum. When you say the word autism, it's almost like cancer. It can mean so many different things. So give us a little perspective as we move forward.
Yeah, absolutely. I mean, so autism is just one word, but just like you have an infection, you can have lots of kinds of infections. Similarly, you can have lots of kinds of manifestations of autism. And so it's critical to be able to diagnose it, because when you intervene early, you can actually have the child grow normally and adjust and actually get to the potential that the child should get to.
But I would imagine that makes it harder to diagnose if there's so many manifestations.
Yeah, and absolutely you're right, Brian, because there is no blood test, there is no brain scan, nothing objective that tells you that the child has autism. So the American Psychiatric Association came up with something called the DSM, or the Diagnostic Statistical Manual, based on which there are criteria that the child fits into, and then the diagnosis is given. Over the past few years now, the diagnosis has been obviously better in terms of physicians being aware of it, parents and children being aware of it, school systems recognizing it. But at the same time, the diagnostic criteria has been has been broadened.
So it has been changed?
It has been changed. So mild cases that originally did not get that label or diagnosis now has that diagnosis.
Well, what are some of the early warning signs that parents need to look for?
I think, again, the American Academy of Pediatrics really recommends that at 18 months and 24 months you start looking for those signs and you get screening done. So a child not interacting with the mother, or not making eye contact, or socially being in his own or her own world is something that you have to look for in terms of warning signs.
Well, the numbers are 1 in 88 children now are diagnosed with autism. Are doctors too quick to diagnose? And as a follow-up, how difficult is it for the medical community to keep up with this demand of so many children being diagnosed?
I think it's not just the medical community, but the entire support system, the educational system, the physicians, the therapists, the vocational trainers. All these folks have to be working together. And if you look at in the last decade, the incidence or the prevalence of autism has increased by 78%, and a lot of that is thought to be as a result of better diagnosis and more awareness. Whether those are real hot spots in terms of increased exposure to toxins or environmental factors or genetic changes is something that's still being researched. We're spending billions of dollars over the last decade looking at this.
On the flip side of the diagnosis part of it, though, there's an effort now to, I guess, undiagnose or to find out who shouldn't be on the rolls of those diagnosed.
Yeah, again, that's something that has to be discussed. And so when you look at the diagnosis, it takes hours to diagnose a child with autism. So one of the good things is, for example, research around even the diagnosis and whether we're making the right diagnosis. So Harvard Medical School, for instance, has just come out with a 7-question survey. And if you attach a 2 to 5 minute video of your child playing, when the child is a toddler, you can actually increase the incidence and the diagnosis of true positives around having that diagnosis.
But how accurate is that testing, and at what age? For instance, I had a 2-year-old incorrectly diagnosed as autistic when really he was having ear infections.
Yeah, that's another important thing. I mean, when you look at the median age for diagnosis, it's around 4 years right now. We do want to be able to...
But you're saying look for the signs as early as 12 to 24 months.
Absolutely, because once you find those signs early on, you can actually bring interventions so that you can help these children, again, recuperate, adjust, and actually recover in some cases from autism. So those are going to be important pieces as we look at managing this and treating this.
And of course, as we see more incidents and we see more money directed toward that, it's important to make sure that those who are diagnosed are properly diagnosed, so that money goes toward those who really need it.
Absolutely.
Can you really cure autism, or is this more about teaching children and young people how to cope?
I think it's more of the latter. I mean, there are some incidents where children have recovered, but mostly in terms of mainstream, it is absolutely coping with your disability and being able to learn those acquired skills that normally we have as innately. So those are some of the things, and that's why the multidisciplinary approach of having multiple providers and support systems and resources available at the state level, at the home level, are critical to be able to get our children to the optimal level of functioning.
Dr. Poonam Alaigh, thank you so much for your insight and analysis on this very complicated topic.
Yeah, thank you.